There's been some confusion over what a doctor from the World Health Organization said earlier this week about asymptomatic transfer of coronavirus. I checked in with Nurse Alice Benjamin to clarify. She was at a testing site at Charles Drew University in Willowbrook.
What we know from preliminary evidence is that COVID-19 asymptomatic spread does exist. And the World Health Organization actually misspoke in their press conference earlier this week. And they've been trying to dial back and correct the messaging. And it's very confusing to people. What we need people to know and understand is that asymptomatic spread of COVID-19 actually exists. It does exist. Now, you might hear different, stories, different stats based on small pieces of evidence. But I am at the front line in the emergency room. I am here at COVID-19 testing sites, and we are hearing and seeing people who have actually said, my cousin tested positive, and we didn't know until the whole family got it. So we are actually seeing that real time. And so it's really, really important for viewers to not be confused by that message. The truth is, yes, coronavirus can spread from asymptomatic spread.
And let's talk a little bit about asymptomatic and pre-symptomatic, because that might have been part of the confusion there as well.
Yes. So when we refer to asymptomatic, that means that someone is not presenting with symptoms. When we refer to pre-symptomatic, what we know is that the incubation period is anywhere from 1 to 14 days. So once someone has been exposed to the coronavirus, anywhere between 1 and 14 days, they may begin to present with symptoms. So we refer to that as pre-symptomatic. So yes, you've been exposed. Yes, you have it, but you've not yet presented with symptoms.
We're talking about the importance of getting tested because we've seen so many different facets of the economy reopen, and then we've also seen a number of people going out to voice in these protests.
We realize the significance and importance of these protests, and there is a way to do it safely, and that's what we really want people to do. So again, wearing your mask, trying to social distance as much as possible. I know we're doing a lot of chanting and saying things aloud, but don't underestimate the use of your signs. You can say a lot of messaging in your signs as well. So we just want people to be safe when they're going out. Even with going out into reopening the economy, we actually here at our test site have a lot of people that come that say, my employer requires that I get a COVID test before I go back to work.
Yeah, it makes good sense because, again, even if you don't have the symptoms, you very well might be carrying COVID-19.
Absolutely. And the truth is, we've only been dealing with this world pandemic for less than 6 months. So we are learning as we go. Things are changing almost every day based on the evidence as it comes along. And it's going to be really important. Until we know the absolute hard facts, we need to operate with safety in mind. And the safest thing to do is to operate in protection because we don't have any cures. Yeah. There's no cures. We're still working on an immunization. So the best way that we can protect the public is to make sure that they are wearing masks, that they are hand washing, social distancing, and protecting one another. So the best offense in this state is the best defense.
All right. Nurse Alice, thank you again for your time, and thanks for all the work you're doing out there as well.
Okay, thanks, Carolyn.
And a reminder of those updated coronavirus symptoms from the CDC. They include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, a new loss of taste or smell, and sore throat.
Well, it is hot out there.